of the Economy and Politics show, the last for this week. It's been an interesting week, and we continue the conversation looking at developments around the economy, policy, politics, and even investments. Today we look at the healthcare sector, which remains a very critical part of our lives and even economy and society. It's important how we treat that sector, and has become even more important in this period as we ease from the COVID-19 pandemic. We meet to discuss around investing in health tech research is Dr. Debo Odulana, co-founder of Doctoora. Good morning, Mr. Dr. Debo. Dr. Debo, can you hear me? Good morning.
Good morning.
Good morning. Yes, and happy Friday to you.
Good morning. I can hear you.
Yes, good morning. Good morning to you. And nice to have you on the show.
Thank you.
Yeah.
Pleasure.
Yes. It's been an interesting period, a challenging time. The COVID-19 pandemic, described by the World Health Organization as unprecedented, but an opportunity for Africa to strengthen its front in Nigeria.
So making moves towards this a long time ago. The system in itself is already crying and has been crying for a while. And now this, and as you've rightly said, the infrastructure find ways to drive investment into healthcare infrastructure. That is quite an issue, and I'm sure that's going to be the crux of our discussion today. In a system where the demand for healthcare isn't guaranteed, is looking to double their returns, and they can only double this return based on the availability of the market.
Yeah. Very of coming back to Nigeria, because
for me, like you said, I worked in the Middle East. I also went to medical school there. I moved back to Nigeria, then moved to the UK, and then back to Nigeria. Now, personally, the first thing is this is home. And I must do my best to figure out how to solve the problems back home, because solving the problems for other people's countries isn't going to improve the situation of my own home, right? So that's like the first reason why I'm back. Opportunities are not present outside this country. And let's be here if you have opportunities. Most of that we see as challenges and problems are actually opportunities to improve health. And without those opportunities, we're probably not going to be, should I say, better off than what we have. If we don't figure out the best way to tackle them and the most sustainable solution out there, then countries that
okay, Dr. Debo, can you hear me now? Dr. Debo, okay.
See the current state of the health system.
Okay, you can go on. You can go on. We're having some slight.
You lost me.
Yes, connection, hearing you, but you can go on now.
Okay, great. So I was essentially alluding to the fact that there's a lot of problems here to be solved, those problems essentially are opportunities, and I came really for the opportunities, because without fixing the health system back home, then we will continue having the same problems of losing close to 1.5 billion US dollars yearly to medical tourism, or our under 5 mortality, or our maternal mortality being high. Those problems are things that we can really solve if we come together and focus on the problems that are here, try to find the root causes of these problems, and prefer solutions that are only good.
Okay, let's get to your Doctoora. And in this period, that there have been really demands for medical services. I mean, we celebrate healthcare professionals like you, and we want to appreciate all the work you're doing this period to ensure that we are healthy and safe and strong. Take us to Doctoora, its service delivery, its strategy, and how this pandemic really took your dynamism, your need to respond to healthcare to another level in terms of innovations and creativity?
Thank you. So at Doctoora, I would say this is a good time for us because it brings what we have always kind of proposed as value to the center stage. A lot of people are actually really now taking notice of what we do. But I would say at the core, we are a healthcare real estate company. We provide health infrastructure to help professionals to start their private practice. And what essentially that means is that we help healthcare professionals who are interested in private practice get access to rentable medical facilities, as well as other technology tools that would enable them use multiple locations for their private practice. The philosophy behind that was that if we are able to increase the number of private practitioners in the country, then we would increase the number of gainfully employed medical practitioners, which will reduce the efflux. By so doing also, and having multiple access points where these professionals can work, we would also be increasing the access to care. So a clear example is in Nigeria, we have a limited number of mental health professionals, limited number of dermatologists and the likes. If we can now get one dermatologist that would normally sit in 2 locations at max to now sit in 30 locations across the country, then we've increased access because people in those different locations are able to now come in and receive care. Now, we've been doing this mostly around helping professionals rent facilities. If you need to book a ward to admit your patient in an area, you can find hospitals within our network where you can admit your patient. If you need to operate, you are coming from outside the country, you have some surgeries to do in Lagos, you can find a standard theater for that. But now with the lockdown and a lot of people changing their approach to seeking health services, the telemedicine aspect of our business has actually come up to the conversations. A lot of companies of HMOs are also looking to get telemedicine provision for their enrollees. So that puts us in the position where even with most partners on our platform, we're having to rethink pricing, we're having to rethink the way the service delivery would be. We're having to intensify our partnerships with companies like My Pharmacy that do our drug deliveries. We're having to remodel our approach to investigations. The partnerships with our partner labs now involve them having to go and collect samples on our behalf of the patient's homes. So a lot of things are changing with regards how health services will be delivered. And we're really happy to be there, at least getting a bit of the limelight, as well as really creating impact.
Yeah.
And we're hoping that with this format, we can move on. The other thing is now, as things are starting to resume, we are gradually also taking that forward position because our services had always been appointments only, which means that our waiting rooms are never crowded. At maximum, we always have maybe a maximum of 2 clients in our waiting room at a time because you've been allotted a time slot, right? So there's no point coming 50 minutes ahead of the time when the doctor is still going to be busy with another patient. So we feel that that in itself would help reduce the infection spread within hospitals because most hospitals have actually been the center point of the COVID spread of late.
Yeah, I mean, the issue of hospitals has been a major challenge, not just in Lagos, but across the country where people are sick and they are turned back sometimes because of the fear that they have the novel coronavirus. This is something that hospitals or the healthcare industry will need to work around, even with commissioners for health across the country, in terms of treating people and ensuring that nobody is turned back, effective tests are carried out. We've had cases of avoidable deaths because of not attending to people and thinking that they have this without pre-test and effective attention and care. What are your thoughts around? Is it not a rising concern at this point?
Yes, it is a rising concern. And again, that's another area where I feel telemedicine.
Dr. Debo, can you hear me? Dr. Debo Odulana has been giving us insight into healthcare. Okay, you can go on.
Yeah, just to know if this is a suspected case or not, you can kind of make a clinical overview and get the person prepared as well. Say, before you come for examination, the steps you're going to do, make sure you have your mask on and all of that, right? If that comes on, then we have a sort of mini triage thing powered by a simple video call that can be instituted by all the centers that most people are trooping to. Now, if that is done, then we'll reduce that burden of people not wanting to treat it. Or rather, of not wanting to be in contact with suspected COVID cases. Because we also know that there's no way we can scale up testing fast enough to be able to test everybody. I'm sure the next phase of the whole management would really have to involve significantly looking at how to use more clinical diagnosis as opposed to relying and waiting for tests. The other aspect to mention is, as we progress in this, the government is also going to expand their activities, especially on the front line and the community. That expansion of activity would bring more COVID-related services to people. And as we get to understand the domain more and the disease more, I'm sure they will relax the treatment protocols, such that private institutions can also start to assist and follow the protocols to treat patients.
I think both of us agree in one place that we need to deepen and strengthen our health infrastructure. And one area that needs core focus is primary healthcare, primary healthcare centers across the country. And we've seen private sector like the Coalition Against the COVID-19, COVID, mobilize resources and funds to support the navigation of this whole crisis. We've seen from the petroleum sector and others. What would you be saying to investing more in primary healthcare? Because this administration target was to revamp and rehabilitate over 1,000 primary healthcare centers. We still want to see more in that regard. We're not really seeing that traction. Isn't it time for us to take that as top priority, even in budgeting and in strategy and planning, not just more of rhetoric? Dr. Debo, can you hear me?
Yeah. Infrastructure aspects of the problem isn't going to just take away the issue and solve primary healthcare. Primary healthcare requires a lot of stuff, mostly the workforce. And when we look at the workforce around primary healthcare, we're not saying carry doctors and throw them to rural areas. Such that they can connect with doctors that would not go to those rural areas, and we get healthcare to people in those areas. So access is a very big area that we need to look at. But beyond access, we also need to look at the financial risk protection. If people have to pay at point of care, and we are looking at the fact that over 90 million Nigerians are spending less than $6 a year on healthcare, then there isn't much we can do for the people at the bottom of the pyramid who need healthcare services. Now, we must figure out how we are going to solve insurance. When we solve that insurance issue, then there's a loop already that will continue to strengthen the infrastructure. At the same point, even if we throw in a lot of money into healthcare infrastructure because people are not going to go and purchase services. They are not going to go to the health systems. And without that, there's no loop and the money will not come back. And those facilities will get back to the previous dilapidated.
So, Doctor, I want to look at the advent of health tech companies. They are really springing up and making impact. We've seen the investments, $15 million into 54 Gene, and we've seen how they've partnered with states like Lagos and Ogun State in helping in spanning the testings and even helping to respond to address the pandemic and provide far-reaching medical services. What are your thoughts around this, and what should we expect to see more in terms of investment in the health tech space and how they can help to ramp up activities in healthcare for Nigeria?
Oh, okay. So my take when it comes to capital and raising funding is the capital always goes to where it's needed and where it thinks it's going to be valued. And I feel that that value is starting to come up. Now, the only reason why these companies are able to raise that capital is because the market is calling for it. So the honest truth is the health tech companies will continue to thrive as long as the market calls for it. So if the market does not engage with health tech, the market does not engage with the inventions, then we cannot have a true sense of it. And I think that's the most important thing for us to look at the market forces, to look at the policies, look at the activities that we're able to their growth is. Funding would always come to.
Funding is very key, but I agree with you about access, and then the issue of medical research needs to step up. And now we're seeing a lot of activities from the Nigerian Institute of Medical Research, NMR. We've been clamoring for research to come forth, to be at the front burner for Nigeria. We've seen what's happening in other countries. Definitely this is a time to deepen investments in medical research. And particularly you're seeing various vaccines and even the Madagascar syrup and other things being explored. Even NAFDAC now also looking at what can be explored from the local but qualified herbal drugs levels. What are your thoughts around deepening medical research, funding and quality?
Again, it's the same philosophy when it comes to funding. Again, we would not be able to improve medical research if the people funding research are not seeing the value. First, I agree with you. As a baseline, we need to improve the research culture and we need to set up more research centers, improve the capacity of the universities to drive research, get more PhD grants out there. Probably we need to get the private sector to get involved more in driving medical research, but then they need incentives, right? People never drive research for the sake of driving research. People drive research that will benefit them. So we research community growth problems, the serious together and start to look for a bit more aggressive request for funding from a lot of organizations. That way, people can start to see the impact of the money that is being spent on research. If they don't see that impact, then more money isn't going to go to research. So as a baseline, I would say for quick impact, we need to go and improve the research infrastructure. Make sure that all the universities have innovation labs, health innovation labs in the medical schools. Start looking for the other bio-allied courses as well, and at PhD and master's level or masters of research level. Start to introduce more grants and projects for them. Start to look for partnerships with international universities that are already running very good research programs that you can leverage on to drive the change that we are looking. Money is not going to come to
So, I mean, this is a very interesting time for the healthcare industry, as we even see interventions, fiscal interventions in terms of waivers for medical products, and then from the Central Bank of Nigeria focusing also on health SMEs, where they need financing and pharmaceuticals. It's a very interesting time from the fiscal and monetary side, the support given to the healthcare sector. But what are the critical areas you would like to be addressed to unlock more of the potentials of the healthcare sector, which is supposed to be at the front burner? Analysts and scholars have talked about it, but it's time for action.
The most important thing is health insurance. If we can increase our health insurance coverage to about 30%, that would be a massive win. We're below 10% now.
Yeah.
And we need to be going for a higher number, but at least as a bare minimum, we can solve that first issue.
Yeah.
A great leap towards universal health coverage. Yeah.
Okay, so health insurance.
That's what I think.
Okay, that's health insurance.
Health insurance is the most critical aspect.
Okay.
Then after health insurance, increasing primary healthcare capacity. And by capacity, I mean improve the infrastructure, provide some technology like telemedicine at that level, and improve the workforce. And by improving the workforce, we need to create a sort of fit-for-purpose, homegrown, local health workforce for our rural areas. And that involves community health workers, bringing those traditional birth attendants in, the local guys in, and just combining it. We know that our cultural precedence in healthcare is the reason behind most of our health-seeking behavior. Before the missionaries were used to using our babalawos and all those people. So why don't we go back to those people and formalize a bit of their education and their practice? The younger ones of them, because the issue is at the point where we stopped interacting with those people a lot, they also lost a lot of their key skills because they weren't being used. So, and we know that their transmission is generation to generation, mouth to mouth. So if one generation did not use skills well, they won't transfer it to the next generation. So now we have those herbal and traditional medical people that are not even well groomed in their medical stuff. So people have not been demanding for their services because they've switched to Western medical intervention. Now, if we really want to make the next big move, we need to look at how to improve those guys and give them some sort of basic questions and use that as a way to pull more people into the healthcare net, pull more people into the preventive health net. If your babalawo is the next person telling you how to manage your diabetes by walking long distances, by doing exercise, by eating specific types of food, trust me, diabetes control at rural level would improve. Because as long as that person also knows that she needs to go and collect the Western tablets from the dispensary and come back for follow-up at the babalawo, who will give her some extra stuff, we will improve the stuff. Yeah. If that is the first level that we get to, we would have created a massive win. And then we now start to add layers on top of that to know that apart from primary healthcare center that is probably going to serve a township or a bigger village, those smaller units, we have agents there that will send people to the primary healthcare center when which really need to rethink our approach. That's the bottom line. And because our health workforce for our health professionals for health are not significant in terms of numbers, we must start to look for ways to increase those numbers, even if it means bringing in more informal health workers.
Okay, finally, I just want to put two questions for you to respond to. Budgeting, very important. Lagos State Governor, Mr. Babajide Sanwo-Olu, said they're looking at increasing budgeting to healthcare sector from between 18 to 20%. And that has been clamor across the country. Nigerian Medical Association, National Association of Resident Doctors, all calling for priority increased budgeting. And there's been outcry over the revised budget, which saw cuts in the health sector. And then also the idea from the private sector that the government and key stakeholders should explore a percentage of the budget, annual budget, going into a fund that can respond to things like pandemic when they arise. What are your thoughts around these issues?
I think it's important that we increase our healthcare spending as a percentage of our GDP and our budget. It has been chronically low for ages, and it needs to actually really improve.
Definitely.
Needs to improve.
Definitely.
So I reckon that it's a very good move, and we must just figure out ways to keep it sustainable. And I really cannot say definitely that this is the best solution or this is the way out. We just have to keep trying things and figuring out how they come, and then using the data from that to improve.
Yeah. Data, leveraging data will be very important for healthcare. And no matter what we do, research is key, funding is key, and stakeholders must take healthcare most seriously. At least, if anything didn't make us realize how important healthcare is, COVID-19 pandemic reinforced that we need to take healthcare very seriously across the whole value chain. Thank you very much, Dr. Debo Odulana, co-founder of Doctoora, for the very interesting insights on the need for Nigeria to increase its healthcare insurance. I mean, it's below 10% and not too good for Africa's most populous nation. On the need for us to expand the capacity of our primary healthcare centers across the country, where we even have interface with the rural dwellers, and also the need to formalize the traditional medicine space, which is very, very critical, herbal drugs that can really help us, and train skilled professionals in that space. Thank you for your contributions. Nice having this conversation with you around healthcare, and hope to have you in subsequent editions review our healthcare when we fully ease from the COVID-19 pandemic lockdown.
Thank you very much. It was a great pleasure being here.
Yes, thank you. Thank you very much. And that'll be all for our Friday edition, the last edition for this week on Economy and Politics Show. You can join our website, www.proshenji.com, to watch our videos, read our reports and analysis. Don't forget, we'll also have our last edition of the market review by 10 a.m. All you need to do is to stay tuned.